My name is Jennifer Stein, and I'm the Medical Director for Medical Dermatology at the Ronald O. Perlman Department of Dermatology at NYU Langone Health. So I take care of patients who are at high risk for melanoma. A lot of them have many moles. So when they come to see me, I think the first thing I want to know is there anything that they're worried about? Because a lot of times patients have a sense if something isn't right or not. Because at home, patients can tell if there's something that's new or changing, and we talk a lot about that. If a patient is really worried about a spot, we pay extra attention to that area and make sure that we've examined it very carefully. I do a total body skin exam on all of my patients, and the beauty of diagnosing melanoma is that most of the time we can make the diagnosis just by looking at a patient. I use dermoscopy, which is a technique that allows me to look deeper into the skin, and this is just a simple handheld device, but it allows you to look deeper into the skin. And by using dermoscopy, we can recognize specific patterns to tell us if there's something that needs to be biopsied. I also see patients with other types of dermatologic problems. I take care of patients with psoriasis. What I like about taking care of psoriasis patients is we have so many different options. If a patient walks in with psoriasis, I know that I almost definitely can make that patient look and feel a lot better. It's a wonderful time to be taking care of psoriasis patients because there's so many different treatment options, and I really enjoy talking to patients about what their different options are and finding the right treatment for that patient. So for patients who are at higher risk, it's good to come in at least once a year, and we decide patient by patient how often that particular patient should be coming in for a regular skin check. For a patient who's just had a melanoma, who has a difficult skin exam where they have lots of moles, or maybe they've had other skin cancers in the past, those patients are going to come in multiple times a year. For somebody who has a lower risk of skin cancer, they may just be coming once a year. We always tell patients if there's something that they're seeing at home that doesn't look right to them, something that's new or changing, they're really worried about it, we ask them to come in sooner. We always try to make emergency appointments available for people who have something that they're really worried about.